Very good morning to our respected judges and their delegates. So my AIOS number is S11557. So I'm presenting the efficacy of modified inverted internal limiting membrane flap technique for the treatment of chronic and large idiopathic macular hole presenting to a tertiary eye care center in Northeast India. In this presentation, I don't have any financial interest. So chronic and large macular hole have the poorest surgical outcome with a closure rate of 40 to 83%. ILM flap technique was reported to increase the anatomical closure rate of large macular holes. This technique is limited by difficulty in maintaining the inverted ILM flap inside the macular hole during fluid gas air exchange and with high rate of accidental ILM flap detachment during this procedure. So the purpose of our study is to evaluate the efficacy of modified inverted ILM flap technique for the treatment of chronic and large idiopathic macular hole. The study was conducted in our hospital as a retrospective intervention study from August 2014 to July 2016. A patient with a chronic more than 12 months idiopathic macular hole larger than 700 micron were included in our study. And the patient with, who refused to give consent, refusal for subsequent evaluation and macular hole of less than 700 micrometers, and a patient with proliferative diabetic retinopathy, exudative age-related macular degeneration were excluded from our study. So our 11 eyes of 11 patients underwent standard 3-port sparse planar vitrectomy with modification of inverted internal limiting membrane flap technique that improve retention of the ILM flap on the macular surface. In this technique, after folding the ILM flap inside the macular hole, approximately 0.2 ml of viscoelastic is injected over the ILM flap, forming a viscoelastic cap that helps in retention of the flap inside the macular hole during fluid gas exchange. A preoperative and postoperative visual acuity and spectral domain OCT images were evaluated. The main outcome measures was visual outcome and macular hole closure rate. So in this video you can see the first we peel the ILM towards the center of the macular hole, and then free floating ILM is trimmed with, under the very low vacuum. Here you can see the trimming of the ILM with very low vacuum. Then we inject the 2 ml of viscoelastic suspension over the ILM. So the main outcome data were the pre and the post-operative West-corrected visual acuity and closure rate of macular holes. So out of 11 patients, 7 were male patients and 4 were the female patients. So these are the tabulated form of macular hole size. So majority of the patients were lying in the age group of 60 to 70 years, and the main minimal linear diameters of the macular hole was 811.4 micrometers. The preoperative main visual acuity was 1.2 logmar, and the main postoperative visual acuity after 12 months or after surgery was 0.56 logmar. Statistical analysis confirmed that there was significant difference in visual acuity between the preoperative and the postoperative visits. So we confirmed the closure of macular hole with a spectral domain OCT in all 100% of cases. The closed macular hole at this point of time has U-shape configurations, and out of 11, 8 eyes who have 700 to 800 micrometers had U-shape configurations, and 3 eyes who have more than 800 micrometers size had V-shaped configurations. Here you can see this is 732 micron macular size, and this line up with a U-shape macular closure. And this is another patient, 897, and it's line up with a V-shaped closure. This is another V-shaped closure. So the present study showed that the mean post-operative logmar best corrected visual acuity was significantly improved in patients who underwent modified inverted internal flap technique. According to McCullough et al., there was high rate of accidental ILM flap detachment during inverted ILM flap technique. So our study also found that the closure rate of macular hole following this modified technique was 100%. And in our study, demonstrated that the macular hole size between 700 to 800 has U-shaped configurations, which is associated with good visual outcomes. But those macular hole with more than 800 micron has V-shaped configuration, which is associated with the less visual outcomes. So we conclude, to conclude, we present a modified ILM flap technique to improve the retention of the ILM flap within the macular hole and improve the reliability and reproducibility of the operation. This procedure is suitable, mainly suitable for redo cases where there is no ILM flap bordering the macular hole. So the main limitations of our studies were the small sample size and the shorter period of follow-up. Thank you.